Welcome back to Cardiopulmonary, Control of Special Circulation, and this is Lynn. In this session, we'll cover the following learning objective: describe the various local, neuronal, and hormonal mechanisms for controlling blood flow in different tissue types, including how they interact to maintain blood flow, differentiate between active hyperemia and reactive hyperemia, and give examples of tissues or organs' ability to display autoregulation. Identify the variation of anatomical structures in various organs and how it can influence the blood flow. All right, let's get started. Special circulations. Blood flow is variable between one organ and another. Blood flow can change by increasing or decreasing, and this is achieved by changing the arteriolar resistance. There are two mechanisms that control our blood flow in our body: the local, aka intrinsic control, and neuronal or hormonal extrinsic control. Local control allows matching the blood flow to the metabolic needs based on direct actions of certain kinds of metabolites. Neuronal or hormonal control uses actions of sympathetic nervous system on the vascular smooth muscle and vasoactive substances such as histamine, bradykinin, and prostaglandins. The GI tract and the liver receives about 24% of all the blood flow. The kidneys receive 19% of the blood flow. The brain receives 13%. The heart receives only 4%. Skeletal muscles receive 21%. And the skin receives 9%, whereas other organs receive 10% of the blood flow. Local control of blood flow. Local intrinsic control blood flow. There are three mechanisms: the autoregulation, which is maintenance of constant blood flow to an organ in the face of changing arterial pressure. Your kidneys, brain, heart, and skeletal muscle have this kind of system. Immediate compensatory vasodilation of the arterioles allows for getting more blood from one side to the other. Active hyperemia is when there is a blood flow to an organ that's proportional based on the metabolic demand. Reactive hyperemia is a sudden increase in blood flow in response to a period of drop in blood flow. So for example, if you were to occlude a blood vessel by blocking the blood flow, there is going to be an oxygen depth that is accumulated. The greater the blockage, the greater the occlusion, the greater the demand for that oxygen depth. In reactive hyperemia, constriction causes a buildup of metabolic waste, which will then cause vasodilation. Therefore, in your skin, you might have this reddish tint color. In active hyperemia, increasing blood flow during increased metabolism to an organ will also produce that reddish skin color. You have the hepatic artery, the splenic artery, mesenteric artery, the renal efferent arterioles, and renal efferent arterioles flowing to the hepatic portal vein, to the kidney and liver, and the capillary bed allows diffusion of the blood from one side to the other, and then the hepatic vein and the vena cava return the blood back. Local intrinsic control, there are two hypotheses that explain these phenomena: the myogenic and the metabolic hypothesis. The myogenic hypothesis is stated as when the arterial pressure is increased, the arterioles are then stretched. Because of that stretching, the smooth muscle is going to then contract. The contraction of this vascular smooth muscle leads to constriction and therefore increases resistance, reducing the amount of blood flow. On the opposite side, if the arterial pressure decreases, there's going to be less stretching on the arterioles, and therefore the smooth muscle is able to relax. This phenomenon explains autoregulation, but it does not discuss how the active and reactive hyperemia works. Recall that there is a law of the place for a cylinder, which states that the T is equal to P times R. T is going to be the tension of the wall, R is going to be the radius, and P is the pressure. If the pressure increases and the radius decreases, then the wall tension T must remain constant. Metabolic hypothesis states that the coronary circulation is most sensitive to the partial pressure of oxygen and also adenosine, whereas in other parts of the body, like the cerebral circulation, it is most sensitive to CO2. Vasodilator metabolites like CO2, protons, potassium, lactate, and adenosine can trigger changes. Increased pressure will cause an increase in blood flow, which will allow more oxygen delivered based on the metabolic activity. And as more blood gets across, it's going to wash out some of these vasodilator metabolites to reduce the blood flow. So remember, a local vasodilation can be controlled by changes in number one, drop in oxygen concentration due to increased metabolism, increased CO2 concentration, decreased tissue of pH, that comes from lactic acid and CO2, and the release of potassium as well as chemicals like nitric oxide. These are paracrine signals. Control of special circulation. Looking at the coronary circulation, the most important mechanism and metabolites are going to be hypoxia and adenosine. Mechanical effects include compressing during the systole, therefore causing occlusion and blockage. In the cerebral circulation, the most important mechanism is going to be detecting of the metabolites of CO2 and changes of proton. In the skeletal muscle, the most important is going to be lactate, CO2, potassium, adenosine. And then in the pulmonary circuit, it's going to be hypoxia as well as vasoconstriction. These are the trigger events that will cause you to have a change in the way the blood flows. Notice that the skin and the renal system do not have specific vasal metabolites. However, the most important mechanism for temperature regulation is going to be the alpha-1 receptors for vasoconstriction. And in the renal system, the most important mechanism for local metabolic control is the myogenic stretching as well as tubular glomerular feedback based on the amount of fluid and ions passed through. Neural and hormonal control of the blood flow. Neural or extrinsic and hormonal control of blood flow. The most important neural extrinsic control of the regional blood flow involves a sympathetic innervation. Blood vessels in the skin and skeletal muscle have a high density of sympathetic nerve fibers. In your skin, you're going to have the sympathetic alpha-1 receptors. When stimulated, it will produce a vasoconstriction. Skeletal muscle is going to be loaded with alpha-1 receptors, which can lead to vasoconstriction, and beta-2 receptors, which can also lead to vasodilation. Some of the key vasoactive substances include histamine, bradykinin, serotonin, and a family of local signals called prostaglandins. These can all trigger changes of blood flow. Histamine and bradykinin cause dilation of the arterioles and constriction of the venules, with a net effect of increasing the hydrostatic pressure on the arterial side. This will then force fluid to exit out of the vessel, leading into filtration and possibly local edema. Serotonin causes vasoconstriction. There's some implications that it is responsible for vascular spasms and migraine-based headaches. In the prostaglandin family, we have the prostacyclin and prostaglandin E. These are both going to be vasodilators, whereas the TXA2, thromboxane A2, and prostaglandin F series are going to be vasoconstrictors. Other signal hormones include angiotensin II. They will target the AT1 receptor to cause potent vasoconstriction, as well as vasopressin, ADH, antidiuretic hormone, which will bind to the V1 receptors, also eliciting vasoconstriction. AMP, also known as the atrial natriuretic peptide, is a hormone secreted by the upper atrias that will cause a vasodilation and increase the fluid output and urination in the kidneys. In the coronary circulation, the most important local metabolite is going to be hypoxia and adenosine. The sympathetic nerve plays a very small role in this system. When you compress the blood vessel, a brief period of occlusion occurs, which reduces blood flow. This will then quickly lead into the reactive hyperemia that will boost up an increase in blood flow, allowing the oxygen to be delivered and repaying that depth that was occurred during the occlusion. Cerebral circulation exhibits autoregulation and both active and reactive hyperemia. The most important local metabolite is going to be CO2 and protons. When there's an increase in the cerebral partial pressure of CO2, this will then lead to vasodilation in the vessels because you want to get rid of that CO2, and therefore the arterioles increase the blood flow to get rid of that acidity. Pulmonary circulation. Pulmonary circulation is controlled predominantly by O2. Keep in mind that the pulmonary circulation hypoxia will cause vasoconstriction. This might seem a little counterintuitive, but this allows you to shunt the blood away from areas that are poorly vented, where the blood flow will be wasted. So you're trying to push the blood to the area where there's more oxygen for gas exchange to occur. In the renal circulation, the renal blood flow is very tightly controlled by the autoregulation based on the constant flow of fluid and blood. The renal autoregulation is independent of the sympathetic division. So that means if you have a transplant, the kidney can still be able to do its job of controlling blood flow. Autoregulation is based on some of the stretching properties of the renal arterioles in that own organ system. Skeletal muscle circulation. The blood flow to the skeletal muscle is controlled by both local metabolites and your sympathetic nervous system. At rest, you have the alpha 1, which constricts. Constriction causes increase in resistance, which will then lead to a decrease in blood flow. Beta 2 receptors cause a vasodilation, which will decrease resistance and therefore increase blood flow. When you're exercising and moving in your body, the vasodilator substances in your skeletal muscle include lactate, adenosine, and potassium ions. And mechanical compression will also lead to reactive hyperemia. So when you block off the oxygen to the area, oxygen debt accumulates and you got to pay that back. Skin circulation is a principal function of the sympathetic division, to alter the blood to the skin for regulation of body temperature. So when there is trauma to the body and the skin begins to release histamine, it produces a triple response in the skin called a red line, red flare, and a wheal. A wheal is a local resulting of edema, fluid accumulation, resulting from histaminic actions that vasodilate arterioles but constrict the veins. For example, during exercise, your body temperature is going to increase. Your sympathetic system that controls the cutaneous blood flow is going to then be inhibited. And because you're selectively inhibiting these regions, it produces that vasodilation so that the warm blood from the core of the body can be shunted to the skin surface to remove some of that heat. Cardiovascular responses to exercise. Two components of cardiovascular responses to exercise include your central command and local metabolites. The central command directs an increase in sympathetic outflow and a decrease in parasympathetic outflow. The goal is to boost up cardiac output and vasoconstrict. This increase in cardiac output is directly related to the increase in heart rate and increase in contractility. So when you exercise, you have the central command, which will then increase sympathetic outflow and decrease parasympathetic outflow, increasing your heart rate, contractility, and cardiac output. It will constrict arterioles to your splanchnic and renal system so you don't lose any blood volume, and constriction to the veins so that you have an increased venous return. Local responses include the vasodilator, dilation to the skeletal muscle so that you reduce the resistance and increase more blood flow to the muscle. Temperature regulation. Hormones, like the thyroid hormone, is considered thermogenic. The major action of thyroid hormone is to stimulate the NAK-ATPase, boost up oxygen consumption, increase metabolic rate, and increase heat production. Exposure to cold environments can trigger activation of thyroid hormone. This will then increase the activation of T4 into T3, T3 being the active form. Since thyroid hormones are thermogenic, if there is an excess or deficit of these hormones, it will cause you to have a dysregulation of body temperature. The sympathetic division also controls the body temperature. In cold environments, it activates your SNS, your sympathetic nervous system. This will stimulate the beta receptors to activate the brown fat metabolic rate and to generate more heat production. Stimulation of the alpha 1 receptors will cause vasoconstriction. And then also shivering, this rhythmic contraction to skeletal muscles to generate more heat. Mechanisms for dissipating heat. Well, whenever the environment temperature is increased, there's going to be more heat crucial that must be dissipated. Most of the mechanisms for dissipating heat are coordinated by your anterior hypothalamus. This begins by increasing body temperature, decreasing sympathetic activity in your skin and blood vessels, increasing the blood flow through your skin arterioles to the venous plexuses near your skin. It shunts the blood to the surface so that your body has this redness and the warmth of the skin. And then when you need to cool down, the sweat glands produce an increased sweating to reduce that heat. And of course, there's behavior components where you remove your clothing or you start trying to get access to a fan.